Sexuality and intimacy are often overlooked throughout the cancer experience. I think people's perception is, okay, sexuality, intimacy, those issues, they're not life or death, and so I'm going to put them aside. I think what people realize over time is they are real quality of life issues, and it changes the dynamics. I mean, cancer changes the dynamics of your relationship, but not being able to engage in your normal sexual activity, not feeling even like you want to be intimate with your partner, that oftentimes has a real long-term negative impact if it's not addressed now. Talking with your physician, and if you're not comfortable talking with your physician, at least coming to somebody like me, a social worker with experience in the cancer world is important. At least we can start a dialogue about some of these issues. And some of the changes that people will find are either physical or emotional in nature. Some of the physical changes can happen due to surgery, so you have scarring. Certainly pain with intercourse is another issue that many cancer patients face. On the emotional side, what we find is that people face body image issues, mood, lack of energy, lack of well-being. Often we only direct this conversation towards the patient because they're the ones in front of us. But in reality, this is a group issue. And so some of those feelings on both sides can be fear of recurrence, anxiety, sadness, frustration is a big one. Frustration that we can't engage in normal sexual activity the way that we're used to. Frustration from the spouse or significant other side, that your spouse or significant other does not look or feel the same, cannot engage in the same activities as they used to. The treatments that we give people for cancer often come with sexual side effects. There are certainly practical things that your physician can offer or suggest or even talk to you about. For women, there are vaginal lubricants, there's moisturizers, there are some oral medications. There is also pelvic floor therapy that can help with tight or tender muscles and relaxation. And for men who are experiencing erectile dysfunction, there are medications. I always recommend that you talk directly to your physician about this because it's going to depend on the treatments, the medication, or the intervention will depend on your diagnosis. It'll depend on what other medications you're already on. At the end of the day, your sexual relationship may not be the same as what you're used to. And maybe that's a short-term issue, and maybe it will be a long-term issue. I think that's obviously individual. But the point is that there are creative and even fun ways around this.